I'm Cole. I'm a physical therapist based out of the Springdale Health Center in Brookfield. I treat a variety of orthopedic conditions, so all post-operative, ACL reconstruction, rotator cuff repair, total knee, total hip, all those post-surgical type things, in addition to your everyday kind of orthopedic condition that'll arise, whether it's a sprained ankle, I pulled a muscle, tweaked the shoulder playing, volleyball or softball over the weekend. We treat all those. In addition to those conditions, I also will treat cervical, thoracic, and lumbar spine. So kind of throughout that whole spinal column, we'll treat that pain as well. In addition to all of those orthopedic conditions, I do specialize in vestibular therapy. So whether that's vertigo, balance problems, we take a look at, and treat vestibular dysfunction as well. My typical patient age is probably from about age 10 to, all the way through, 100, however old patients may be, treating those types of conditions for those patients. I received my undergraduate and doctorate of physical therapy from Marquette University. In addition to those, I have gone through a couple orthopedic certification course series, in addition to some advanced vestibular continuing education. I am also pursuing a clinical specialty in orthopedics. So that's the management of orthopedic conditions, spine care, looks at lower extremity, upper extremity. So that's a current test that I'm undergoing as we speak. I view patient-practitioner interaction, it's got to be a team game, okay? We need to find a strategy that works for each patient. No two patients are alike. And just because one thing worked for someone doesn't mean it's going to work for that specific patient. So we need to really sit down and have a good conversation. That's how the visits will typically start, with a conversation of what's bothering you today. Things change from session to session. We need to identify those things and then make sure that we're addressing those most pertinent things each visit, progressing. And so that way we're not just doing something and progressing along, but really hitting what's most important to make care as efficient and as optimal as possible. I definitely enjoy creating relationships with patients. You see patients hey, we had a knee replacement one year, and then the next year they go in for a rotator cuff repair. Hopefully those things, are more spread out for patients. But if not, that developing that relationship, everyone has their own dentist. You go to the same person. That's what I strive to be, as someone's physical therapist for, life. So really developing those relationships with patients, getting to know, hey, what did you do, over the weekend, learning about grandkids, house shopping, those types of things that in those 45 minutes to an hour session, we really get to know patients. It's not, just a couple minutes. It's creating relationships to advance people throughout whatever, pain or ailment they may have. I chose to go into physical therapy. It was kind of a family tradition, if you'll say. My mom's a physical therapist. I have an aunt who's a physical therapist. So from a young age, I had been exposed to it. And then throughout a couple injuries throughout my high school and collegiate career, really decided, hey, this is something that I want to do. I want to help people get back on their feet, get them back to what they love doing, in addition to being able to, hey, we get to spend time working with weights and gyms throughout my day, which is something that I enjoy, and seeing a patient progress from where they are when they first walk in, whether that's with a cane or a walker or with a little bit of a limp, to being able to, hey, let's solve that and get you back to doing what you enjoy doing.